having a good time and a good life. Welcome to N2N podcasting. My name is Rick Harper, and today we're talking about mental health. It's one of those topics that we seem not to talk about, but we all suffer from. And the title of this podcast is, Am I Crazy or Not? Today I'm here with my friend Tim Siegel.
Hi, Rick.
And Tim, I think friendship is, how long have we known each other?
40 years.
Oh gosh. We met each other in kindergarten when we were 5 years old. No, but it's fascinating how friendships occur. And first I was your mentor,
That's correct.
right? And then we became friends.
That's right.
And in friendships, it's typical that we learn to lean on each other.
That is right. Yes.
And I think about friendships, there's always 40 years friendship. I don't remember every day and every encounter with you, Tim. Sorry, buddy.
Oh, yeah.
But I remember moments and stories where you made a difference in my life and I made a difference in your life.
You bet.
And I remember, Tim, you were at the university and I was your mentor and I was trying to teach virtues, like patience and, believe in faith and love and all that kind of stuff. And usually you didn't pay attention. But one night I remember you were aware during our time together that me and my wife were trying to have children. And we kept on getting pregnant, but she kept on losing the baby. And the last time she lost the baby, it was really hard. So I was talking about, you got to be resilient, you got to have faith, right? But then I just stopped. Remember that night where I just kind of...
I do. I remember it well.
Stopped. Remember looking up and going, I don't have faith in what? When do I believe it?
Right.
Because I want to know, where's the creator, the God, the one in control of everything? Where is he right now? And then I remember some of your, I guess they were...
My peers.
Peers, that's a good word, okay? One said, well, he wanted a rose up in his house, so he took one out of yours.
That's hard.
I wanted to slap him, okay? But, I was a mentor, so I had to keep him peace. Another one said, hey, don't worry about it. Everything's going to work out in the end. And I was just like, about to have it, right?
Right.
Because I was really hurting, and I was confused. And then I remember you, and it's probably one of a memory that just opened the doors maybe to me to think about being deeper in spirituality and dealing with life and death and struggles. You said, Rick, you used to stammer a lot. You just humbly said, Rick, I don't know why that happened, but I know the Creator is with you and He's crying alongside you. And that was probably 35 years ago, and I still think about that story and how much you meant to me in our friendship again there. And then you got married.
Yep.
Married you and Nancy, which was really cool. And you moved to Tennessee, away from Atlanta. And we saw each other here and there.
Mm-hmm.
Sometimes a couple times a year. Sometimes we went years without speaking.
Sure.
But that friendship was there. And I slowly I quit being your mentor, and I became your friend. And I remember about 20 years after that incident with my miscarriages, and we ended up having kids, which you're aware of. My wife interrupted me at night. I was doing some reading, and she said, Rick, something's wrong. Nancy, your wife, is on the phone, and she wants to talk to you about Tim. And I tell you, what's up, Nancy? And she says, it's Tim. It's Tim, and why don't you take the story up from there?
You bet. So Rick, I'll have to go a little bit back. So when I was young, a child, I noticed that my father he would pace the floor at night. And, you only don't have really one family, so you never think of it as being odd, right? You think that everybody goes through that.
Yeah.
And so I didn't, I grew up with that, so that was that. And then, I became a young man, and then I got married, and then, when you pick up the story, we moved to Tennessee, and it was a stressful time. At the time, my mother was ill. My wife and kids were in a different state. I was living on my own. I was under a lot of pressure in life. And I slowly began to notice that my moods began to affect me. I felt sad at times and dark.
You couldn't understand why.
And I didn't understand why. It just never. I've never had that feeling, those feelings before.
Right, because you were happy-go-lucky.
I felt like and I'd always thought, because I'd never experienced this, I actually went into a doctor. And I went to the doctor and I said, hey, this is what's going on. And he kind of looked at me quizzically and kind of like threw up his hands and kind of wrote me down a little medicine and whatever. And that was it. And so it never even dawned on me that this could be what we call mental illness. Because there's a big stigma in the United States and I think elsewhere that thinks that mental illness is some sort of weakness, like it's a character flaw, like you just gave up or you quit life.
So it's okay to go to the dentist because you have a toothache or to the doctor because you break your leg, but
that's exactly right.
When you start saying mental illness, it's like I'm nuts.
It's your fault.
Yeah, it's your fault.
You did something you did something wrong, and you're just trying to make up for it by saying I've got a mental illness.
Right. It's more like this reads like Tim.
Mm-hmm.
You have 2 kids and a wife. You need to be happy and be thankful.
That's a fact. In fact, someone said to me, because I had difficulty working, I had difficulty concentrating, and I really wanted to. I had 2 kids, and so I remember my boss at the time. I walked in and I said, I'm overwhelmed with grief and sadness. And he looks at me and he goes, take the day off and go have a picnic. Oh my gosh.
What we all need is just take a day off.
I know.
Our problems are solved.
Rick, the funny thing is that part of what I had, which is a mood disorder, food didn't taste good. I couldn't sleep. Nothing felt good. I'd look out and because I didn't get any medical attention, because the medical community just didn't even recognize it in me. I began to just lose interest in my children. I began losing interest in my wife. It was like the only world that existed was I was trapped inside of this darkness.
Why did you not? Did you share this with friends? Did you share this?
I was scared to. It is scary to. What do you tell them? Because unless you've been there, it's hard to explain. And many people will judge you when you talk to them about it.
I say right now, I've not had a mood disorder. My wife has, and so in that way I understand, but I don't understand.
It's hard to understand.
Right.
People will still think, particularly they'll say something like, oh, you're sad, what happened? Well, that's the difference between a mood disorder and just regular grief. Grief comes in because of maybe a death in the family or something that happens, a tragedy. But a mood disorder, it can be a holiday. It could be and oftentimes you hear about people that suffer through mental illness through really great holidays, like in the United States.
Right.
And that is probably a key aspect is that your emotions begin to control how you see the world, even when everything around you is fine.
How did your wife and kids respond to this? Were they worried, concerned, or?
Well, my kids were small enough that I don't think they remember. They were 3 and 5.
Okay.
But my wife, a couple of aspects is that I lost concentration on days and times. I mean, I'm an engineer, so I wear a watch, and frankly, I look at it quite often to try to know exactly. But it was very difficult for me, and so my wife knew something was wrong. And it's not like they can take you in if you've got a mood disorder and run an X-ray and go, "Yep, there's the mood disorder."
Right.
So it becomes this issue of, oh my gosh, it's happening, but how do we go forward?
So I guess, this was 20 years ago, and really mental illness was not talked about.
No, it is a huge stigma. There's no
I mean,
question about it.
Anxiety, mood disorders, depression.
All of it.
I mean, people would say about those, like, we gotta get your life together.
That's right. In fact, I'll give you another. So it runs in my family. I told you that my dad used to pace the floor, and then I have it, and it's. I mean, fortunately, I go through different processes. I take some medication, which is medication really to help my brain chemicals stay correct. I get good sleep, and I eat, and these are things that I do, and I work out to stay healthy. But my daughter, I passed it on to my daughter, and I think I mentioned this to you, that to tell her story, and she's going to allow me to tell this story.
You got her permission.
I got her permission,
That's
which
great.
is, again, it's a sensitive topic.
Right.
So
Even now,
if you've got a family member or you feel, it is something that you want to be safe with. But getting back to my daughter's story, she had been a short-term missionary in Africa. And of course, when she came back to the United States, it's a stressor. You begin to get under stress because you go from really one world back into another world,
Right.
and she's under a lot of stress. And she was in university at the time, and she called me up and she said, "Hey, Dad, I don't feel so good. I can't concentrate." And I said, "Oh, okay. Are you feeling moody, sad, despondent?" And she said, "Yes, Dad, I am." I said, "Okay. Well, we need to get you in to see a doctor, and we also need to see if we need to take action on other things." And so one of the things that I did was that I called what would be kind of considered like an administrator of students,
Right.
who she was in charge of the student body, and I called a meeting, and I sat down with her, with my wife, myself, and this administrator of students, and I explained to her that my daughter was experiencing a mood disorder, that she could not concentrate to study, and that one of the first things I was going to do was to get her into a doctor to help work through this. And I said the second thing is that I would ask them to suspend her classes. And I said, because she can't concentrate. This is not going to be reflective of her abilities. And this is shocking that the administrator of students said, "Oh, I'm not going to do that. I'm not going to suspend the classes." And I said, "What? You're not?" She said, "No." And I said, "Let me ask you a question. If she were in a car wreck and she had a head injury, would you suspend her classes?" She goes, "Of course." I said, "But you're not going to suspend her classes now?" She goes, "No." So I realize now, and I realized then, and I realize now that the stigma of mental illness is still there. That widespread people don't recognize that someone who is suffering from a mental illness is exactly in the same condition that someone would have heart disease or cancer or any sort of illness to the body that needs repair for them to be made whole.
So when your wife called me that night, it was like she reached out to me. right? And that's important to reach out to someone she respected. And I remember that night because you just sat there. She said, "You got to talk to him." And man, you were not the Tim I know and love. I remember you yelling at your daughter, Isabel, and that was kind of the start of you saying, "Okay, let's get help."
Rick, I will tell you that the darkest moments of a mood disorder are about as close to hell on earth that I've ever seen.
Yeah.
In terms of person, and you feel distant to everybody. You feel completely alone, and so and one of the saddest parts is you see your family members in pain. And so by reaching out to you, it was like a lifeline. You were my friend, and you not only talked to me, but I could see that you talked to Dancy. And I know I couldn't say it at the time, but just knowing that you were supporting those around me when, frankly, I couldn't do it was miraculous.
So, I mean, I think as I lived through your story, lived through you were in the valley, and your family member, your wife this time, she finally had it, and she didn't know what to do, right?
That's right.
And so she says, "I have to call someone I trust."
That is absolutely, you have to reach out. It will not get better on its own.
And your wife's a incredible woman, and she's a proud woman.
Oh, no question about it.
But I think there came a time, and she probably hit it too. And she probably said, "I can fix it. I'm your wife. I can fix it." And then there came a time when she went, "This is not my husband. I'm scared he's going to take his life. I'm scared he's going to go down a hole and never be able to come back." And so it seemed like when I was talking to her, she'd been trying to pull you out. And that night was the time when she had no more strength.
You got it. That's right.
Yeah.
I mean, because she had never been there before. She was trying everything. She had never been around it before. It was brand new to her. It's brand new to most people. Sort of the first time.
Yeah.
It's like, I mean, it's like literally, it's like living exactly in the same place, but your world is completely changed. And it's for those people that are experiencing it, and it's for the family and the friends around them.
And I think you said that, during that time, I mean, you were in hell. And the fact that you recognized that you were treating your kids like, it had to hurt you, but yet you're sitting there not knowing what to do.
No question about it. Absolutely. That's right. That's part of I think that's a lot of times why self-harm is associated with mental illness, is because it's not because they're trying to stop their own pain, but they're also trying to stop the pain that they're incurring on people around them.
I never thought about that. I've always
In fact, you've heard probably the people that say the world would be better off without me. You've probably heard that.
Yeah.
And I think that's what they're saying.
Yeah, that I think the world, and probably I have thought that they're being totally selfish.
You were, I think, absolutely.
It's like, you need to.
I think they were being brutally honest.
You need to be thankful, so I do think that I need to. I mean, this is enlightening that I don't realize when they said the world would be better without me. It's not about them as much as I'm hurting the family and the people I love and my friends.
You got it. And what I've found since then, when I wasn't interested in this until I had it.
Right.
But as I studied more, I mean, there have been people that have suffered from this they have been and I'm not one, but there have been other great people who have suffered from this.
Yeah.
And you can see where, they recover, and then they may have a dark period. They recover, have a dark period. They write great things. May have done great things. And I guess going back to the point is that the comment of saying the world would be better without me, the answer is it's not. For people, although they may think that at the time, the truth is the world wants them, and they need to know.
Like
Van Gogh, Winston Churchill, a lot of great artists.
Right. And I wonder what would have happened if there was medicine and if mental, I'm thankful that you live in a time that it is spoken about.
No, quite. We're getting better. I mean, it's
still
slow.
a stigma, right?
It's still a stigma, but it is getting better. Actually, if you want to know, the funny part is that one of the main writers of the first English dictionary was bipolar.
Huh.
He actually wrote it from a hospital. They would come, and there's a movie, Mel Gibson is a lead in it. But anyway, I'm kind of digressing.
I'm saying that.
But yes.
How I'd much rather tell you that I have the flu.
Absolutely. No,
I mean,
there's a
even
huge...
right now, and I love you and I know you, I feel like for me to sit there and cry out for help that I'm depressed, I don't understand, or I have this mood disorder, how can we overcome that stigma?
I don't know that we will. I do know that there are probably going to be people out there that they're either going to themselves or their family members, and you wouldn't even expect it, will fall ill. And at that point, it'll become real to them, and hopefully they'll have seen this podcast and they can reach out and get help.
So you would say it's better to act than to wait, kind of thing. Like,
you're rescuing somebody from hell on earth.
So I'm not a therapist, I'm a doctor, and so if I notice a loved one or a friend who's not acting, what?
Usually you see somebody that maybe they lose interest in food, maybe they no longer get pleasure in seeing their kids play, or or maybe a transition in life where they're sleeping a lot, or they seem to really be disgruntled for no reason at all. That's the time, and especially if it begins to get, and you ask them, and you can tell that their mood is beginning to control their, having difficulty concentrating.
Our human intuition. Your wife knew Tim, right?
Yeah.
And then all of a sudden, she sees you slowly, and then here you are.
Yeah.
And you're not the Tim.
That is correct. Yes.
And so those are the time. So I think that the key. Well, okay. What are the keys when you feel like you have this mood disorder, but you're not a doctor,
Mm-hmm.
and when you feel like a loved one is suffering?
I think the first thing is to give grace and to yourself. Don't blame yourself. It's not about blame. It's not about saying that you're a failure, or because the truth is that many people who have these type of disorders, once they're able to get the proper help, whether it's therapy or medicines, they are back to their normal selves and functioning. And so the first thing is recognizing that you think you need help, and don't blame yourself, and then be patient, and begin the process. We probably saw minimum 20 doctors before we found one that kind of recognized what was going on. Right. And my condition was a little bit different. I didn't have just depression. I reacted very well to some of the drugs for my condition, and so after that, 6 months later, I was, really back to myself. But I've got to be careful from now on.
Right.
But anyway, so that's be patient, and then keep searching for help.
So when you find yourself in a hole, you can't climb out yourself.
No way.
It is time to look for those who love you.
Yep.
And let them throw ropes.
That is absolutely right.
And when you love someone and you see them down the hole, you can't crawl down there.
No.
You gotta look for help to help to throw them the rope, and then encourage them and love them and give them grace.
100%.
Well, Tim, I appreciate you sharing the story, and it is. I'm joyful for you,
Well, thank you.
and I'm just so happy to have you back. And I know your kids and your wife are, and I know you're glad to be back.
No, I'm. Every day is a blessing for sure.
What's your final thought, Tim?
I would say that that I'm glad I went through it. If somebody asked me, said, Tim, would you go through it again? I would say, yeah, I would. It was hell, but what it did is I've become the poster boy in my circle, because you wouldn't imagine that anybody that goes through it, they reach out, and they don't know where help is, but if they hear somebody that has gone through it, that's who they seek out. So my comment is for everybody is that I would encourage you, if you think you have somebody that feels that they're suffering, is take action and don't stop, because they may at the time not act like they're thankful, but once they get on the other side like I am, they will be.
My final thought is, if you're concerned about self-harm, if you feel like you have this mood disorder, or someone you love is suffering from mood disorders, N2N on the bottom of this podcast will give you a number to call and reach out, because it's not only your life may depend on it, but the ones you love will be affected. Thank you, Tim.
Thank you, Rick.